right, we're good to go. Everyone ready here? Good afternoon, everyone. I know these unscheduled briefings are or can be a little bit stressful, and but from the very beginning of COVID, we've done our very best to communicate as quickly and as accurately as possible, and to share the news as we learn it with Islanders. Yesterday's news of a positive COVID-19 case connected to West Royalty Elementary School was tough to hear for all Islanders, in particular for students, teachers, parents, and family members of that school. Since then, our public health and testing clinic staff have been working diligently to try to determine the source of this case and if there are further cases. Dr. Morrison will share with you shortly. There are new cases that have been identified. Some of those additional cases are connected to West Royalty School, meaning by the definition outlined by Health Canada, we now have an outbreak at that school. While we have had cases connected to a school in the past, this is the first time since the pandemic began in March 2020 that we have to declare an outbreak in a school setting in Prince Edward Island. Based on this information and the extent of the testing that will need to be undertaken in the days ahead, Dr. Morrison has issued an order to suspend in-person classes at West Royalty School for this week. As well, there's a positive case identified to a student at Charlottetown Rural High School. And based on this information we have gathered in the last 24 hours with the vast numbers of close contacts that will need to be tested, as well as the vast number of identified close contacts within a number of schools in the Charlottetown area, Dr. Morrison is further ordering the suspension of in-person learning for schools in the Charlottetown Rural and Colonel Gray family of schools for a period of 3 days. CPHO and Health PEI staff will use this time to complete widespread testing of close contacts, and further recommendations or orders will be made based on the information we learn over the next 48 to 72 hours. For many, I know this is a lot to consume, and most of us were very hopeful that incidents such as this were in our rearview mirror, but here we are today. As we have in the past, when we have faced difficult and uncertain events, we have moved quickly and implemented measures to help us to the best extent we can to learn as much as we can and to contain the virus from spreading. These decisions, as you all know, are not made easily, but I can say to date that we have never regretted making the tough decisions to go hard and to go fast when needed, when COVID rears its ugly head in our province. And to date, it's been a great benefit for us to have done that. And it's our hope over the coming days with the completion of broad testing that implementing measures like this quickly will be beneficial again in this current situation. The reality we face is that many of the positive cases are connected to a segment of our population that can't get vaccinated. We know also that children under 12 are able to best excel when they're in classroom learning, when they are able to participate in extracurricular activities, and when they're able to interact with their family and their friends. And it's important that we do everything we can to catch this as early as we can so that we can get back to getting these students back into our classrooms and allow for them to have as normal of life as possible. And as you all know, as we've been saying from the beginning, that remains our goal. But we also know at the same time we're dealing with the fourth wave of COVID, which is spiking sharply across the country, as well the Delta variant, which we know is in our island shores, and the many challenges that these bring with them. I know these are difficult days, but I think if we follow what we have been doing from the beginning, that we will be in a good place. And with that, I will turn it over to Dr. Morrison for a further briefing. And we also have Norbert Carpenter from the Public Schools branch who will be here to answer any questions about how in-person learning will be impacted in the days ahead and what we're doing from an educational perspective to do the best we can for parents, teachers, staff, and students. So over to you, Dr. Morrison.
Thank you, Premier. And I think you outlined most of what I'll also be saying, and I'll try not to repeat all of it. Thank you certainly for coming to this unscheduled briefing. We do have a serious situation with COVID-19 transmission in PEI children to talk about today, and it's important for the media and the public to be aware of the details that we know. Yesterday, we announced a positive case with a student at West Royalty Elementary School, and today we are announcing 6 additional cases of COVID-19 in PEI, all in children under the age of 19. 4 of these cases are close contacts that were announced yesterday at West Royalty Elementary School, and they're all related to that school. Another case is a student at Charlottetown Rural, and one of the new cases is a close contact of a previously announced case last week and is not associated with a school. 10 out of our last 11 cases in PEI are in children under the age of 19, and all but one of these cases are in children who are not eligible to be vaccinated. None of our cases are in hospital. The situation, as the Premier pointed out, at West Royalty Elementary School is considered an outbreak, and this is our first school outbreak in PEI since the pandemic began. This is an evolving and concerning situation. Our investigation of these cases continues, with contact tracing and testing underway as we speak. Confirmed cases are required to test and isolate. Close contacts are being identified and will be required to test and self-isolate, especially those who are not fully vaccinated, and all cases and close contacts will be contacted directly by public health. We currently have identified over 50 close contacts, and the list is growing. I fully expect we will have more positive cases in the coming days. At this point, we have not been able to identify if these cases are linked to travel outside the province. As our investigation continues, we may be able to identify a potential link to travel, but until that time, we will make decisions based on there being community transmission of COVID-19 in PEI. We are erring on the side of caution, assuming that new cases are the highly transmissible Delta variant. We know that COVID-19, including the Delta variant, seeks out groups of people who are not vaccinated, and that is what we are experiencing. This variant is more transmissible, even in children, though there's no evidence to suggest it causes more serious or prolonged illness in children. We know that children who do get COVID-19, including the Delta variant, often have mild symptoms. However, while rare, they can also become more seriously ill. They can also experience symptoms of post-COVID condition or long COVID. At this point, we do not know the extent of transmission of COVID-19 in our schools or in our province. Our public health system needs time to complete the investigation and contact tracing for each case and gather more information. Most importantly, we need more people to be tested. I ask that any island resident or visitor in our province with even mild symptoms of COVID-19 to be tested. I am concerned that we do not know the extent of the transmission of COVID in PEI. While we are seeing an increase in cases of COVID-19 in children, this causes us to be concerned about potential transmission to others in our community who may be immune compromised or not fully vaccinated. Some individuals who are fully vaccinated may not have mounted an optimal immune response, are immunocompromised, and are more vulnerable to COVID-19. And it's important we take time to learn about the extent of transmission in PEI. I think we mentioned the other day we have over 40,000 individuals in PEI who are not fully vaccinated, and that includes those who are unable to be immunized who are under age 12. Based on the recommendations, as the Premier mentioned, both to the Premier and to Cabinet, the following measures will be implemented. School closure of West Royalty Elementary School for the next week. Any child that attends this school who hasn't already been tested in the last day should be tested as soon as possible. Similarly, all staff at the school who've not been tested in the last 24 to 36 hours should be tested as well as soon as possible. Other schools in the Charlottetown area, and I will read them out, including Charlottetown Rural Senior High School, Colonel Gray Senior High School, Birchwood Intermediate School, Glen Stewart Primary School, L.M. Montgomery Elementary School, Parkdale Elementary School, Prince Street Elementary School, Queen Charlotte Intermediate School, Sherwood Elementary School, Spring Park Elementary School, St. Jean Elementary School, Stone Park Intermediate School, Stratford Elementary School, West Kent Elementary School, West Royalty Elementary School, École François Buot, Grace Christian School, and Emmanuel Christian School will all be closed for the next 3 days, Monday, Tuesday, and Wednesday. Students and staff at these schools should monitor themselves closely for symptoms and arrange to be tested if they develop any symptoms, and even mild ones. Anyone who is a close contact of a positive case will be called by public health nursing and will be advised on testing and isolation. These schools will not be available for use by community groups during the time they are closed. By the middle of this week, all other schools in the province will move to elevated risk level measures for public health in the back-to-school plan. This means implementing cohorting in the K-6 schools and additional cleaning measures and physical distancing to the extent possible. Early childhood centers will remain open across the province. There will also be a 3-day suspension of recreational and extracurricular activities for school-aged children under the age of 19 in the Charlottetown area, and those school-aged children under age 19 from the Charlottetown area should not participate in recreational or extracurricular activities outside the Charlottetown area for the next 3 days. And that includes not going from Charlottetown, for instance, to play hockey in Alberton or Summerside. These activities include hockey, skating, dance, gymnastics, soccer, karate, ringette, to name a few. And provincial and regional groups responsible for organizing provincial activities in these areas really should consider canceling these activities until Wednesday. Families should limit social gatherings for youth, including sleepovers, birthday parties, and play dates for the next few days. To everyone else in PEI, I ask that you be cautious and take extra measures until we know more about the extent of COVID-19 transmission in PEI. There is one notification related to a flight from late last week, and that will be included in the news release, but it's a WestJet flight 330 on Friday, September 10th, arriving at 12:15 p.m. And anyone on that flight should monitor for symptoms and be tested if any symptoms develop. This is not the news any of us want to hear, and certainly not the information I want to be sharing on a Sunday afternoon or at any time for that matter. As the Premier mentioned, in the past, we've never regretted our decisions to act quickly and strongly and increase our testing when we needed to. I do think we really need to get an extent understand the extent of what is happening in the transmission, and we will do so with our testing and some of these measures in place. I appreciate the cooperation and support of all Islanders, especially the staff in the education system and students and their families. We will provide a further update by Wednesday afternoon, and we will get through this like we have over the last 18 months, doing it together. And now more than ever, let us be patient and kind towards ourselves and others. Thank you.
Thank you very much, Dr. Morrison. And just before we turn it over to questions from our friends in the media, I also want Islanders to know that we know the impacts such a decision can have on families, in particular families of students from kindergarten to grade 6. So for the next few days, I would strongly encourage employers in this province to be flexible and to allow parents and guardians of those who might have students in the Charlottetown Rural and Colonel Gray family of schools who may need to stay at home with students for the next few days. I would strongly encourage them, if they can, to allow parents and guardians to work from home. And in doing so, it would help reduce the impact on families. If that's not possible, like we have done in the past, we will be supporting Islanders through government programs for those families and parents and guardians who need to stay home. More details will be available tomorrow, and links will be put onto our website for those programs. So just to reiterate, if you cannot go to work, if you cannot make suitable arrangements for childcare or make suitable arrangements with your employer to work from home, our government will be here to support you. And as I said, those links will be added to our website as quickly as possible. So with that, I will turn it over to questions from our friends in the media, and remind all of those that Norbert Carpenter is here as well from Public Schools Branch if you have any questions that might be specific to the educational component of this decision.
Tony Davis, CBC.
Hi there. It was mentioned that a vast amount of contact tracing was needed and kind of being done here. Are these cases linked to sports or activities which could see, students from different schools interacting?
Hi, Tony. So at this point, there does not appear to be a link related to in terms of the cases to any particular sporting or extracurricular event. But as we always do in these situations, we learn how busy so many children are, and they participate in many activities. And I think there will be certainly teams and other friends who are in not only in one school but maybe involved in different activities that we need to contact.
Okay, and this is just based around education, I guess. Will schools be moving to online learning for the impacted schools? And if so, how quickly can this be implemented?
Hi, Tony. So to answer that, I'll answer it in two parts. For the 3-day shutdown of the Charlottetown and Colonel Gray family of schools, which excludes Dona, by the way, Dona will have school as normal this week. There won't be remote learning taking place for those 3 days. That's to allow for testing and all that has to be done to help CPHO. However, for West Royalty students, we will initiate remote learning, and we'll have that ready to go on Tuesday.
Okay, thank you very much.
Thank you, Tony.
Nicola McLeod, CBC.
Hi, good afternoon, everybody. Do we know the vaccination status of the people who have tested positive, obviously not including those under 12 who cannot be vaccinated?
So I think I mentioned it, that 10 out of the our last 11 cases are in children under the age of 19, and all but one of them really is under the are not eligible to be vaccinated. So we're not giving out individual cases vaccination status, but certainly the majority of these cases in children are children who are not able to be vaccinated.
Thank you. And second question, as public health measures are added in the coming days, if we do start to see more cases, might we see mandatory masking or other measures being reinstated?
So, Nicola, I think that the first thing is, at this point in time, we're trying to get more information. We have masks in place in schools in terms of any, and that's been outlined previously. It's still recommended, and I'm glad you asked the question because it's a good chance to remind everyone that masks are recommended in indoor public places when you are unable to maintain 6 feet from each other, or I think it's that continues to be the recommendation. Those will be all things that we'll consider as we, in terms of what we learn over the next couple of days. I think we're trying to do what we can now so that we don't have to take too many steps backward as we go into the fall. We still want to think about moving forward, learning to live with COVID, but I think it's important that we manage this really well now. Because we want to limit the extent of any transmission that is happening here so that it doesn't start to affect large groups of people, and that will ultimately impact our healthcare system as well. So we will continue to make adjustments on what we learn in the coming days, and look at all these measures, but and also where the transmission is happening. And we know a lot of transmission happens in social settings with close contacts, often where masks aren't always being worn. But we know it's very clear nationally, provincially, that masks are recommended and will continue to be.
Logan
thank you.
McLean, The Guardian.
Good afternoon, everyone. I have a question about long COVID and whether the numbers are being tracked. And if they are, what sort of numbers are with that? Like percentage of people, full and partial disability afterwards, age, things like that?
So I think it's a really good question. I think it was a couple of briefings ago that I did have some of the details in around long COVID, and we're certainly, as a country, learning more about long COVID now that we've had more people have COVID. We have. And I don't have all the percentages right in front of me, but certainly we can get that. And there's information posted on the Public Health Agency of Canada website in terms of the number of the percentage of people who have symptoms that remain, one or more symptoms that remain even after 12 weeks. And then the percentage of people who are not ever able to go back to work, for instance, because of long COVID symptoms, even after a period of weeks that they still have ongoing symptoms. So I think that information on long COVID will continue to evolve as we learn more. And but I have spoken about it before, and I certainly can bring back some of those details on another time or by email.
Great. And just once more on the education side of things, in terms of preparation for events like this, must have been expected. So what's been done to make, especially with Rest Royalty, they're going remote, what's been done to ensure a seamless transition, especially this early in the year?
Yes, thanks for the question. You're right. This early in the year, schools are just getting up and running, and very complicated systems being put in place. So many things have been done, and just a few things. First of all, the safety of the students and staff is paramount. So a deep cleaning is being done at the school at this point. We have an operational plan that has already been tweaked for when school commences to have cohorting back in place. Really stressing the importance of all the measures, including good hand hygiene and masking. So we really are asking all our students to wear masking when it is recommended. We've had great compliance, but we still see pockets of students not wearing masks, and we'll be asking our staff to enforce the policy we have in place. There are a few things that we are doing right now, and in terms of remote learning, the Department of Education and Lifelong Learning have the platform up and ready, and we'll be making that transition and distributing technology to students if they do not have those at home. So we do have many plans in place for that transition.
Okay, and just the last thing, an investigation that would take some time. What does that entail exactly?
Sorry, I might ask you to repeat the question just because I think I was going to add something to Norbert in terms of how they were ready. The Chief Public Health Office did have a chance to meet with the administrators of the school in what we called a tabletop exercise to sort of run through the things to consider and think about if exactly this kind of event happened. It happened earlier than I thought it would, but we certainly were thinking it could happen. So that was another way of the school, at least considering some of the preparation that needed to happen. So I'm sorry I missed your question.
Just what exactly does the investigation entail? How long might it take?
So we've been doing every case we've had for the last year and a half and we've had outbreaks in other settings, certainly that we've looked at over the last year and a half, and involves certainly history and talking to the case and the family, reviewing the activities that have happened. It involves then testing as well of the close contacts, and sometimes there's more information that becomes apparent after even speaking to a family more than once or 2 or 3 times, and then you're able to then establish some links in between cases. For instance, did they all attend the same social event? Were they in the same class? Are they on the same bus? Were there other family connections? Were they involved with the same activity? So that's where the more testing we can do and the time we take with each of the cases and their close contacts can all help give information. So this is public health, nursing, and our epidemiologists who work really closely, and the team and Chief Public Health Office with the support of many people outside of that all help get the information we can, and we have to act on the information we have at the time. So we're hoping we will learn a lot more in the next couple of days, and usually we are able to do that fairly quickly.
Thank you.
You're welcome.
That's it? All right, well, I think that's the end of our questions. I want to thank Norbert and all the staff at Education and Public Schools Branch, and of course, Dr. Morrison, and just ask everyone to remain patient and vigilant here in the next couple of days ahead, and to rely on the past 18 months or so of how we have done things here successfully in PEI, and let's remember that wish the best for those who have been tested positive, and continue to hope they're doing well. So thank you very much, and we'll be in touch in the days ahead. Thank you.